Top 20 Licensed Professional Counselor, LCSW, Interview Questions and Answers. The Licensed Professional Counselor, or Licensed Clinical Social Worker, LCSW, is assigned to work as mental health services provider. The LCSW has the role of assessing people for any disorder and providing a course of treatment. They help teenagers, adults, and elder people deal with interpersonal and mental health issues and cognitive behaviors. To get this job position, you will go through interviews that will include the following questions. To be able to answer those questions, you must follow the tips and create the answers according to your background experience and the sample answers we provide. So let's get started with the top 20 questions. 1. Why are you interested in this role? Sample answer. I have always wanted to be a source of helping people with emotional and mental problems. I have seen many people suffer from these core issues. Along with that, I have also seen so few people or organizations that are ready to help people with their mental issues. This is why I wanted to be a part of such a job role. It can lead me to help people with their mental issues, hence, I found a licensed professional counselor to be the ideal opportunity. 2. What are the roles of a licensed professional counselor? Sample answer. A licensed professional counselor holds a master's degree in mental health service and is trained to work for individuals, groups, and families in treating their behavioral, mental, and emotional issues and problems. 3. What are the qualities that a licensed professional counselor should possess to be effective? Sample answer. This role deserves so much more than just dealing with normal office processes, so one must possess certain abilities and qualities. In this role, one should possess the ability to handle people and all kinds of behaviors. To be effective, an LCSW must have great communication skills, show acceptance, have problem-solving skills, be flexible, have self-awareness, and be competent in multiculturalism. 4. What major challenges did you face during your last role? How did you handle it? Sample answer. As a licensed professional counselor, I had to face a certain challenge. No job role exists without certain challenges, and mine was the same. In that role, I had to face patients who were reluctant to receive counseling. They were just so hard to open up, and this led me to an edge, trying my hardest to make them speak to me. I also felt challenged when I had to deal with a disjoint system. 5. Describe your daily routine as a licensed professional counselor. Sample answer. My everyday routine was to meet people and start their counseling sessions. A few patients were regular patients, and a few were new. I had to encourage my clients to open up and express their feelings to discuss what was happening in their daily lives. Then I had to help them build insight into themselves or the relationships they have. I often gathered information about the clients through interviews and tests. 6. Briefly describe your licensed professional counselor experience. Sample answer. As I mentioned before, I was always inclined to help people find a way out of their mental health issues. Therefore, this job role is just perfect. I love being on the front end and being available to help people at all times. They find help through me and start looking at themselves in a new way, and I love being there to help them out. 7. What strategies and mindset is required for this role? Explain with examples. Sample answer. I understand that working with the human brain and psychology can be a challenging thing to do, but I know how to tackle most of it. I have been practicing soothing people from their mental health issues, and I have gained much experience to do so. My mindset is always based on no judgments. I love helping people open up to find solutions to their problems, which I encourage them to do with great success. 8. What is the biggest challenge that you foresee in this job? Sample answer. I have worked for quite some time in this department, and now the daily, mundane tasks have become a normal routine for me. When it comes to dealing with difficult people, this can be challenging at all times. This is what I foresee as the biggest challenge in this role. 9. How do you stay motivated at work? Sample answer. I have always worked to find the actual cause of patient issues, and the goal is to see my clients happy and healing. This very thing is my motivation. I get motivated whenever I find someone living his or her life normal again. 10. Describe a time you failed in this role and the lesson you learned. Sample answer. I once had to meet a patient who had been dealing with mental health issues for 20 years. I assumed him to be making it up or not being as affected by the disease as he portrayed, but I was wrong. I didn't carry out his treatment appropriately, and this was a failure on my part. I learned that I must be thorough and understand the patient's mental health symptoms more in depth before I proceed with any kind of treatment. 11. What are your favorite therapy models? Sample answer. I believe in many kinds of therapies. Whether short or long-term, they can each work for a different client with a different backstory. As long as the therapies are bringing someone out of their mental cocoons, I believe it is working fine and should be continued. 12. When is the time to separate the groups to start a concurrent individual therapy? Sample answer. I believe that the ideal time to spur the groups to be a concurrent individual therapy is when the test knowledge of adaptive and destructive processes surround the splitting groups. I think this is the right time to separate groups and run concurrent therapy. 13. What is the difference between anxiety-related conditions and the autism spectrum? Sample answer. Although there is no link to anxiety with ASD, most kids and patients of the autism spectrum represent increased anxiety levels. In my experience, the biggest difference between the two is the illustration of diagnostic abilities. 14. How strictly are you going to stick with the diagnostic criteria defined in the authoritative manuals? Sample answer. In this process, I will first evaluate the awareness of cultural variations that are the pertinent symptoms and assess the confidence that one has in the discretionary abilities. 15. How are you going to handle a case that became tough to handle because of your experiences? Sample answer. In such a case, I will first examine the idea and perception of the job and the referral process's difficulties. This will help me assess how to handle a case that becomes difficult to handle. 16. Which orders are increasingly comorbid with the phantom limb syndrome? Sample answer. For this, I will inspect the knowledge I have about obscure conditions and the concomitant presentations they represent. One possible explanation for having phantom limb pain is because the nerves in parts of the spinal cord and the brain start rewiring when they lose the signals originating from the missing leg or arm. They send signals of pain that are a typical response when the body senses that something is wrong. 17. How will your counseling style help the organization? Sample answer. Being a licensed professional counselor, I have always worked by infusing the ideas and processes I have to treat my patients. This helps me in building a data set of therapies and treatments that encompass every individual. I have built my style of communicating and reading the other person's body language through the experience and education I have. Due to my eagerness towards this role, I am often unique and complementary. 18. How have you developed your abilities of patience? Sample answer. Showing good mental health and patience is important for a licensed professional counselor. Patience has taught me several things. I learned a lot about patience when I was a teacher and needed someone to help me through the process of mental health issues. 19. How would you define success as a licensed professional counselor? Sample answer. This job can be very taxing, especially for the clients who keep changing the order's scope. Every client session will have different outcomes, and it will not always feel like a success. My definition of success is having more prominent milestones to aim for, and then reaching them. 20. Is a therapist and a licensed professional counselor the same? Sample answer. A counselor has several background experiences, and he might have a master's degree through a counseling education program. On the other hand, therapists can introduce themselves as being licensed professional counselors. Conclusion. These were a few questions that may be asked during an interview for a licensed professional counselor job role. Good luck with your next interview.